Good morning, everyone. So what an honor and a privilege it is to introduce to you our president, Dr. Ehab Hanna, who's currently professor and vice chair of the Department of Head and Neck Surgery at MD Anderson with a joint appointment in neurosurgery. Dr. Hanna is internationally recognized for his expertise in the treatment of patients with skull-based tumors and head and neck cancer. A native of Egypt, born in Cairo, where he graduated from the medical school and completed his residency at Cairo University. Can you guess where our young, or should I say even younger president is? In 1988, he immigrated to the United States, where he completed a surgery internship at Vanderbilt, working hard, or should we say hardly working. He then moved to the Cleveland Clinic, where he completed a second residency in otolaryngology, head and neck, and this is their graduation picnic. Following this, he pursued advanced fellowship training in skull-based surgery and head and neck surgical oncology at the University of Pittsburgh Medical Center. And then in 1994, he was appointed as faculty at the University of Arkansas, where he quickly rose to the rank of full professor and was endowed as the James Sun Endowed Professor, as seen here. He was then recruited to MD Anderson in 2004 to lead their skull-based program and the Multidisciplinary Head and Neck Cancer Center to join two of our past presidents. At MD Anderson, he has built a world-class skull-based program. Now, Ehab is a mover and shaker, and once he has a plan, he orchestrates it beautifully. Here's a picture I took on my cell phone a few years ago when, during our retreat in Chicago, he was explaining his vision for AHNS 2.0. And I think we've all witnessed at this meeting, at our council and business meetings, how much additional momentum the society has gained with this reorganization. Now, Christina from BSc works closely with the president, and I asked her, describe Ehab's style. And she said, he's great and an effective leader and provides the perfect balance of providing guidance when he needs to, yet encouraging others to thrive in their own leadership positions. I also reached out to Brian Berkey because as secretary, you work really closely with the president, and Brian said, he's a guy driven by excellence and caring, obtains consensus on critical issues, but will step in and lead himself when it is the right thing to do. So here is a versatile doctor who has 170 peer-reviewed publications, is editor-in-chief of the Head and Neck, but knows how to balance work and fun. And I think this is so important for our younger generation where we're all trying to deal with this. His favorite hobby is windsurfing, and he practices twice a week and races weekly. He decided to go to the national competition 4 years ago, and here he is in the green sail. Way to go, Mr. President. When there's no wind, he likes to go under the water scuba diving in the Caribbean. His love for the water started early on the shores of the Mediterranean and the Red Sea in Egypt. He also loves traveling and the outdoors. But his real passion, though, is his love for his patients, and he treats them like family. For the last 15 years, Dr. Hanna has consistently been named one of America's best doctors and top doctors in cancer. His other love is teaching the residents and fellows. Now, mission work with the orphans in Africa, I think his two lovely daughters here in the front row introduced him to their extended family of orphan kids in Zambia. But his passion is his real family, his wife Sylvie and his daughters Gigi and Camille. His most favorite thing in the world is being dad to his amazing girls, If Ehab's family would please stand and be welcomed by our society. Ehab, if you will please come up and
Whoa. Thank you so much, Sherry Ann. I can't decide whether last night was more emotional or just sitting here and listening to you is more emotional, but I think this is probably the best introduction I've ever heard of my own career and path, and most importantly, my life. So I appreciate that very much, and I know that the society will be so much better in about 1 hour from now when I hand you the baton to be the next president of the American Head and Neck Society. Can I have my slides, please? Yeah, thank you. So, you know, as the president, one of the immediate things that come to mind is, what are you going to do for the scientific program? Because it is the highlight of the year. And of course, every great leader does one thing really well: select those who will take charge of what happens next with the scientific program. And if I ever get any credit for what happened this year, and of course I don't need to even ask you what you think about the scientific program this year, the only credit I will take is for selecting these two individuals who have done a phenomenal job, Neil Gross and Carol Fakhri. And thank you very much for outstanding scientific program. May I give them a round of applause, please? Now, the theme of the meeting is value, and you heard a little bit about value yesterday from Michael Porter. And value can be defined in the economic sense, but value can also mean the preciousness or importance of something that one holds near and dear to their heart. So I'm going to spend just a few minutes, that's the privilege of the president, to honor some of the most important people that my journey from where I came from till I have reached the point where I'm addressing you from this podium has meant to me in terms of values. This was last year, Washington, D.C., and it was the past president's dinner. Jonathan Irish was president, and the backdrop is our nation's capital. Now, as you heard, I grew up in Egypt, and this was 30 years to the date since I have moved to the United States. This was last night. Same event a year later in the Oasis in Austin, Texas. Again, standing with the past presidents. Now, let me just tell you what that means to me. I shared this a little bit with them last night. But growing up in Egypt, and last year, looking over this event to our nation's capital, I had to reminisce about what this really meant to me at a personal level. So that journey with an intermediate stop in Europe to get my FRCS in London started in 1988. Can I go back 2 slides, please? And the individuals listed or shown on this picture were the people that when I was a young medical student, a young ENT resident, heard about, saw their names in textbooks like Cummings of otolaryngology, like Tucker of laryngology, like Myers and Son in head and neck cancer, like Shaw, Atlas of head and neck surgery. Now just imagine a young Egyptian intern going to the library and getting these books out. The giants, the leaders. And since I can't afford buying them, I either read them in the library, and this will not go on record, photocopy. Copyright issues infringed, but I didn't sell them. And of course, these were the heroes to me. I never imagined that one day I will meet them personally, ever. Only to end up last night having dinner with Cummings, sitting at the table with Tucker and Son, being honored with Myers, Senior, Junior, and Weber, traveling with Jay Shaw. It's like a little boy shooting hoops, thinking about basketball in an obscure part of the world, only to find himself playing with Michael Jordan. And today, being asked to be the captain of the team. Thank you. Of course, some cultural adjustments have to be made when you move from the pyramids to the Lone Star State. And as they say, as different and things might be, things remain the same. But in addition to some of the cultural adjustments, I have to say that I have learned so much. As the president, while I have learned from every individual and others not shown on this picture by just observing them, I would like the chance to honor some of the people that have been most influential on this journey for me. First, my guest of honor, Dr. Harvey Tucker. I met Dr. Tucker first in this hotel in 1987. It's the Nile Hilton, where Dr. Tucker was the visiting professor in Cairo, facing extreme hardship in Egypt, trying to plow through obstacles to become an academic head and neck surgeon. I listened to Dr. Tucker lecture in the afternoon. In the evening, gave him a ride back to his hotel and told him that I'd like to go to the Cleveland Clinic, which he then offered me an observership for 3 to 6 months, but I had to secure the funding, which I did, and it sustained me just about 6 weeks. So I had to generate some money at night. No, I was not a Chippendale. I did not have the physique, nor the tendency or the talent. All I could do is wash dishes in this restaurant, not too far from where I rented my 3rd floor bedroom apartment in Cleveland Heights, only to go in the hospital and do research in the morning and observe the giants. One night, as I was washing dishes, in the corner of my eye, I see Dr. Tucker coming to have dinner in that restaurant. I asked my waiters, who were my seniors at the time, being the busboy, to hide me. Which, as much as they've tried, failed miserably. Dr. Tucker, heading to the men's room, sees me with a bus load full of dirty dishes and an apron, and literally asked me, "What the hell are you doing here?" I said, "I am paying the bills, sir." To make a long story short, 2 years later, I applied for the otolaryngology match. My match list had 1 program because I applied for 100 programs and had 1 interview at the Cleveland Clinic. A match list with one program on it. My colleagues were saying, "Are you that stupid? Or are you that cocky?" I said, "No, I just don't have any other choices." Then the rest is history. And what I'm going to do with this honor and with the next is share the one or two things I have learned from these very influential individuals. I got this letter after the match, and it's probably the most influential letter that I've ever received professionally. It is my acceptance to train at the Cleveland Clinic, a second residency in otolaryngology, head and neck surgery. So I learned a lot from Dr. Tucker, but the lesson from him that I take home is what he said when he got me to his office. "Ehab, you may not be able to change the world, but you can change someone's world." Dr. Tucker, thank you for changing my world. Please come to the podium so I can honor you publicly. Now, I know Dr. Tucker is not short on words, but before, and I know he really wants to come here to the podium and say something, but before that, I have brought him a very special gift. And this is the apron. This is the apron I wore washing those dishes, and it says, "Thank you, Dr. Tucker." Now, for disclosure, I have actually the original apron, but it was so dirty, I couldn't give it to him. So thank you very much.
I have 2 slides. I hope I do. Yes.
Switch, please.
The 5th commandment, which you see on the screen, admonishes us that we must honor our parents. Next slide. The rabbinical comments on this include the fact that we are admonished to honor our teachers as we do our parents. I accept this honor on behalf of all the teachers that I had and all of the other teachers that Ehab had, without which he wouldn't be here and neither would the rest of us. Thank you.
This reads, "The American Head and Neck Society wishes to present Harvey M. Tucker as the guest of honor for the annual meeting 2019. Thank you. Can you please go back? As the journey continues, after I finish my training at the Cleveland Clinic, I have the good fortune of going to the University of Pittsburgh, where I was supposed to have fellowship training. Well, what I didn't know, that it was going to be more than fellowship training. Of course, the fellowship training part has to do with the surgical expertise, the clinical acumen, the advanced knowledge in what will become my dedicated career in head and neck oncologic surgery. And you can see here the master showing the young one how to do it right. But what I didn't realize, that it was going to be more than just a fellowship. Now everybody knows Dr. Myers as Gene, his nickname. So we have this inside joke that it was not a fellowship, it was gene therapy. And this is what it looks like. You get transfected, where the gene gets incorporated in your DNA, and then you pass it on, you transfect other people. And there's a bystander effect, where people just observing you gets transfected. And the good news is, there's no cure. What is the gene? It is relentless and uncompromising pursuit of excellence. Once you're transfected, you look at yourself, you raise the bar for yourself, and when you achieve it, you raise it even higher. You become self-critical of everything that you do until it is just perfect. You own it and you take pride in it. So much so that just a few months ago, I had asked Dr. Myers to write a foreword on a textbook that I co-edited. And he looked at it and found a few, more than a few, mistakes. And he said, "Ehab, do you really want your name on this product the way it stands?" I said, "Sir, what do you mean?" He said, "There are a few grammatical errors, some mislabeled figures." I was like, "You were just supposed to write the foreword, darn it." And he offers to take the book, edit it again for errors, all 30-some chapters, and when I offered him to be a co-editor on the book, front cover, he said, "Not necessary. I just want it to be good." That's the kind of gene therapy I'm talking about. And forever, I'm going to be trying to transfect everybody else that comes my way. Dr. Myers.
Thank you.
Thank you. Thank you so much. Thank you so much. Appreciate it.
Thank you. Do I say a word?
If you want,
I'd like to.
please.
Yeah, thank you very much. It's amazing the way the time goes by so quickly. It seems like just yesterday I was giving Ehab his certificate when he graduated from our program from the Head and Neck Fellowship, and here we are. So I hold Ehab in great respect. He's a hero and an inspiration for us. Why? Well, you heard his story about all that he had to go through, and he was relentless in his desire and his drive to be an excellent otolaryngologist, and he's achieved that. And in addition to that, he's held many, many leadership positions in our field. And so we are inspired by your accomplishments, and it gives us the courage and inspiration to go along. I just wanted to mention one thing about gene therapy, that our family is unusual in the extent that, as far as I know, it's we're the only ones who have 2 generations of presidents of the American Head and Neck Society. So I'm so proud of that. In fact, they even have a license plate that says Jeff's dad. Thanks very much, Ehab.
Now, one really good thing Dr. Myers also did on top of it is he directed me to the next phase of my life, and with no uncertainty. He says, if you want to make anything out of yourself, you need to go meet my good friend, James' son. So the next chapter of my life was pretty much written by Dr. Myers saying, this is your next chapter. And I couldn't have been luckier, really, to have listened to his good advice. I met Dr. Suen for the first time in the interview process as a young faculty. Now, I know there are some young faculty here in the audience, and I don't know what your interview was like. Dr. Suen picked me up personally. He didn't send the driver, didn't send his first-year resident, didn't send an Uber. There was no Uber then. But he came personally to pick me up at the airport, the chairman. And I thought, wow, that's pretty impressive. I'm in a suit and tie. He's in shorts, t-shirt, and flip-flops. I'm like, I thought this was an interview. He goes, it is. Then we stop at the side of the baseball field where his son was playing. 2 lawn chairs. We're watching the game, and the interview starts. And that just tells you the kind of man he is. For the next 10 years, I had the privilege and honor to be mentored and really schooled in leadership by James Suen. And as I said, I've learned so many things from these individuals, but I'm only focusing on the one thing that I took home with me in my heart from my experience with them. Here's what I took from James Suen. Servant leadership and innovation. Servant leadership looks like you put everybody else ahead of yourself. And that's what he does. And for 10 years, he promoted me, he supported me, he introduced me to many, many people, and I'm forever grateful. The second is innovation. The guy doesn't stop. 3 weeks ago, he was visiting Helmut Gepfer, professor at MD Anderson, and he was talking about a new way of diagnosing melanoma in vivo in the veins using a laser. I don't know how old he is. Of course, nobody can tell because he doesn't age. And I thought it was a secret Chinese potion of some sort that he ingests every day to have this eternal youth. But I know that it's probably this innovation that keeps him young and vibrant. Dr. Suen, please come to the podium. After 10 years, I received a phone call from now who I consider one of my very best friends, Randy Weber. And I had essentially a conversation with him that have lasted a change in my career to the current day, and that was 14 years ago. Randy is known to everybody as a formidable leader in this society, an incredible teacher, a fantastic surgeon, and someone who every aspiring head and neck surgeon really looks up to. And I worked with Randy as his vice chair. He had just moved from Penn as the chair, and when I was recruited, I became his vice chair. And for the last 14 years, essentially was his right hand. And I observed him very closely, professionally and personally. And here's what I've learned from Randy: to lead with integrity, which almost invariably will earn everyone's trust. Now, you may not always agree with Randy. You may agree, you may disagree, but you will always trust Randy. And for that, I am honored to be his right hand for the last 14 years and now one of his best friends. Randy, please come.
Thank you so much. Sure. Thank you.
I think they decided they won't say anything because there's no time for the presidential address. I know that's what everybody's thinking right now. That's what I'm thinking. Now, what happens when you sort of enter this circle, you end up going full circle. So I first met Jeff Myers in Pittsburgh when I was the fellow and Jeff was the 3rd or 4th year resident. It's kind of a unique situation because his father was the chairman. So here I am, I'm the fellow, the chair is the father, and the resident is the son. It's the elephant in the room, right? And normally you have to sort of, as a fellow, beat on the resident, let them work hard and get it right, which you can't really do if their chairman is their father. And then you're supposed to sit in the fellow's room and sort of moan and groan and complain about the chief to the residents, which of course I couldn't do because the resident was the son. So I found myself in the unique position of feeling like the cream in an Oreo cookie, sandwiched between Myers Sr. and Myers Jr. But I looked at this diagram, and given my complexion and their blonde, blue-eyed, white skin, I felt more like this. Now we're talking. This is the right Oreo cookie. However, I have to say that no day, no moment did I feel that this has been an entitled position for Jeff or a preferential treatment from Gene. Jeff has been a superstar in translational and basic science research, an outstanding leader of the society. He was a president 2 years ago, and currently my boss, the chair at MD Anderson, a position I competed for with him, and I remember going to his office saying, Jeff, if you become the chair, I will be your right-hand man, as I have with Randy, and I will be completely satisfied. And he looked at me and he says, and if you become the chair, I will be completely satisfied. So, what have I learned from Jeff? The value of camaraderie and collaboration. And at the end of the day, after all was said and done, I'm honored to be his friend and his right hand at MD Anderson. All right. Now, for the final award, the president gets to choose the one individual, which is very difficult in a society like this, because everyone is dedicated in incredible service. But this year, one individual in particular has spent an enormous amount of time with this restructuring, reorganization, implementation. He's also the chief of the busiest of the divisions of the American Head and Neck Society, and the amount of work and dedication he put into this is just incredible. Bill Lydiot is someone that we all know. We actually know Bill more like this, where he wears his white coat and takes care of patients as a dedicated physician. But Bill's service to the American Head and Neck Society didn't just start this year. You can see his track record of dedicated, continuous service to the society. But this year, I honestly and candidly could not have done the president's job without Bill. So Bill, please come to the podium. And this reads, the American Head and Neck Society wishes to present William M. Lydiot with the Distinguished Service Award for outstanding vision, dedication, and commitment to the organization. Thank you. Thank you, Bill.
Very much.
Thank you. All right. Let me see if I can wrap this up so I can get to my talk. Now, many of those individuals are sitting in the room. This is my pride and joy. These are the fellows I have trained since 2004. Some of them have become chairs. Some of them are on the way to become chairs. But no matter what they're doing, they have really changed the face of this specialty and will continue to do that. It's really difficult for me to highlight anyone here in particular, and I can't tell you that there's anyone in particular I'm more proud of than the other. They're all my pride and joy. And then my current family at work, the MD Anderson team. And here's the guy at the top, right here. He's sitting right there to the left, Helmut Gepfert. He started all this, and I know that he's looking at this picture and seeing his son, Ryan Gepfert, right here as one of the faculty, and he also is probably filled with pride and joy. And of course, this year, we've lost one of our pioneers, and not too long ago, another of the pioneers. We miss them dearly, as I know you all do. I couldn't be more privileged to work with this family of outstanding, dedicated clinicians and innovators. And then finally, I want to thank my mom and dad, ever since I was a little child and as I was growing up, to encourage me to dream. They have put incredible sacrifice for me to be standing here before you, both personal and financial. And my home team, sitting at the front, Gigi, Camille, Sylvie, I want to thank you for your support throughout those years, and going with the theme of just picking two things. Your support would be number one, and your grace, number two. I know that I've tried always to be the best father and the best husband. I've not always delivered on that, but your grace was unfailing. So for that, I'm very grateful, and thank you for being here. All right, so now I have 20 minutes to give an hour lecture. I'm going to end on time. That's what happens with overachievers. I know there is lunch to be served, so you're gonna see me fly through some of the slides. This took a lot longer than I thought. And I thought that instead of just harping on what has been done in the last year, which you've heard about, the divisions, services, and sections, this is just a screenshot of my email address. I made a folder for AHNS 19. And what I want to show you here is just the number of emails that this structure has generated in the last year. Almost 1,600 emails. So it's been a busy year, but it's really a reflection of the incredible energy. And I know you can't read any of this, and I don't have time to go through it, but last night in the business the business meeting, there was just one achievement after the other from all the divisions, the services, the sections. Everybody has really done an incredible and a tremendous job providing things from guidelines to manuscripts to a library to 2 or 3 new grants to traveling fellowships and on and on and on. So what I want to talk to you about so much is not what we have achieved, but what we're going, but particularly what are the threats and how do we deal with them. So looking at that structure, the section structure is actually the one that probably has done the most in realigning our thinking process. And here are our 6 sections. And they are doing great. However, let's look at some of the competition to what we have earned as a society over the last several decades. Competition in the things that continue to be the scope of the entire practice of head and neck oncologic surgery. Mucosal, oromaxillofacial surgery, and dental specialists really want to do oral cavity cancer. In fact, they are now proposing and achieving a certifying board in that specialty. Of course, the competition for endocrine surgery is as old as the age of this society, and whether it's going to be otolaryngology or general surgery, and it continues to move on. Cutaneous. The most surgeons have put a petition to want to get advanced certification and training in cutaneous malignancy. Skull base. The American Rhinologic Society has now put forth a fellowship training in neurorhinology. Reconstructive. 2 major boards of ABMS, otolaryngology, plastic and reconstructive surgery, competing in this area. So what do we do? How do we manage the ever relentless pressure to constrict, compete, and perhaps overtake some of what we have traditionally worked so hard to gain? What are our options? Well, what is competition? Competition arises, that's the definition, when at least 2 parties strive for a goal which cannot be shared, where one's gain is the other's loss. It's a zero-sum game. That is one definition of competition. Now, the problem with that, if that's what we're thinking about, is that one outcome, like here, would be that there's at least a 50% chance you're going to lose. Or even worse, eaten, swallowed. So the question becomes not so much about the competition, but the nature of the competition. And on the issue of value and volume, this is going to define how we are going to respond to this question of the nature of the competition. What is value? So we talked about that definition, the monetary worth of something or the regard, preciousness of what it holds to your heart. You've seen this yesterday from Michael Porter. And how do we increase value? Well, it turns out that competition and value are intertwined. Throughout the economy, competition in any industry is the most powerful force yet to do both, increase quality and reduce cost. Look at computers. The competition was between Apple and Microsoft. Look what happened over the years. This is the computer processing speed. Computers were souped up typewriters that could only do text or typing a letter. Today, they're streaming high-definition videos. And they've become a lot smaller and faster, yet cheaper. A few decades ago, only a few could buy a computer. Now, anybody can own something in their pocket that can do just about anything a big computer can do. It's called an iPhone. And you don't have to spend a fortune to get one. And look at Apple's gross income. And Microsoft is not a loser either. So you're thinking, if they are dropping prices all the way down, is that a race to the bottom? And you can see from their income that that's not the case, because value has been created within the system. And it's globally. What about healthcare? Is that the situation in healthcare? Did competition do that? Competition in healthcare could not be more different. Costs are high and continue to rise, despite a fierce struggle to control them. Quality problems exist. There is large and inexplicable differences in quality across providers and geographic areas. And competition does not reward the best performers. Technological innovation is slow to diffuse and is considered part of the problem of the price. Taken together, these are inconceivable in a well-functioning market. And of course, they're intolerable when the market is about health and healthcare. So here's an example of what's happening to the costs. You can look at it as per capita spending or percent of GDP. This is the United States per capita, percent of GDP compared to the rest of the world. And in fact, we do that mostly when we reach taking care of our older population, over age 60. That's when our curve really takes off. But are we getting our money's worth? Here's the USA spending, and here's the life expectancy. In fact, we are well below some of the other countries that spend a fraction of the dollar. And this high cost is limiting care. This is the number of people not getting health care because it's damn too expensive. And what about the quality? Is there evidence that there is uneven quality? The problem is not that the quality is bad. Some of American healthcare is truly superb. It's world class. We know that because people from all over the world get on an airplane, travel to the United States to get healthcare here from every corner of the globe. So the problem is not that the quality is bad, it's just uneven. We know that in the system, there are areas where quality gaps do exist. So here is the punchline. We are on a dangerous path with a toxic combination of high cost, uneven quality, and limited access to care. Why is competition failing? Because we are competing at the wrong level. We are competing on how much we do regardless of what happens with what we do, the outcome that matters. You're going to say, but patients are not computers or cars. Is competition relevant or even tolerable in healthcare? Well, it really depends on what you are thinking. It is not about beating somebody on one-upmanship, being better and winning. It's really about innovating, creating a new way of doing something. Here's an example back in the 50s. This is Boston Children's Hospital, looking at cystic fibrosis. Leroy Matthews put together a team of people, comprehensive sputum cultures, percussion treatment on the chest for cystic fibrosis, prescribing antibiotics only according to the culture, physical therapy. And here's what happened after he published his paper. So many more kids with cystic fibrosis did not die. They lived. And this was only matched by lung transplantation. Do you think Dr. Matthews created value? So, how do we define value? That's the Institute of Medicine, 6 definitions. I have to say that we probably focus so much more on safe than anything else. The government today is spending so much money measuring quality by safe. And you can see the acronyms, JCO, ARC, NSQIP, ACOs. And this is the kind of thing they are measuring. Hospital mortality, who's dying in the hospital, how long are they staying, when do they come back, who gets a blood transfusion, who gets a wound infection, and my favorite, UTI. Let me give you my example. Some of you heard that example. A guy had a parotidectomy by somebody else for parotid cancer. The surgeon went in, partial resection, left tumor behind, inadvertently cut the facial nerve. No UTI. Then I see the patient, he still has cancer, paralyzed face, take the tumor out, reanastomose the facial nerve, cable graft, and our plastic surgeons did dynamic reanimation using a free flap. We put a Foley in, we got a UTI. I went to Nisquit. The first surgeon got a glowing quality score. We got dinged. The UTI was cured with 10 days of Bactrim, $10. What am I saying? Is it important to measure safety? Of course it is. Safety should be implied, and of course it should be measured. Unsafe practice should be shut down. But what is quality? Is the question, are you safe or are you good? Which is really more important? Is quality the avoidance of an adverse outcome, or is it the achievement of a desired outcome? You saw this slide yesterday, and I just repeat it here today just because of its significance. In the 80s, when people were doing kidney transplantation, there was only one outcome being measured, which is how many of those were alive, how many of those grafts were alive 1 year after the transplant. They didn't measure washing hands or typing donor to recipient procedures or immunosuppression adherence to the guidelines. They measured, at the end of the day, is the kidney alive in 1 year. You can see that the range here is huge, with some people well below the 50% and some of the outstanding hospitals at the top. But because they measured the desired outcome, just the simple measurement really improved what happened afterwards. So how do we deal with this here in this society? In head and neck cancer, it may be survival, speech, and swallowing. Skull-base tumor resection, neck dissection, number of lymph nodes, shoulder function, thyroid section, freedom of disease, normocalcemia, and vocal function. Carotid cancer, freedom of disease, facial function, and so on. It turns out that defining what really is the goal of the intervention is not that difficult. Why is it so important? I'm going to stick with the example of sinonasal cancers. It's important because we have to know if we are improving in delivering the care. This is our sinus cancers at MD Anderson, and we have always learned that every decade we're doing better. And you can see it here. If you're not doing better, you need to find out why, and perhaps change what you're doing. It's important because we might want to evaluate the limitations of what we're doing right now, or the effectiveness of new techniques, robotics, or endonasal skull-base surgery. In order to do that, we looked, the blue here is the endoscopic and the orange is the open. We looked at our open experience, and we looked at this is the survival. So that's the benchmark. Then we looked at our endoscopic, and we realized that that, in the right patient, provides the same desired outcome. Not only that the outcome may be survival, but it may be avoidance of harm. So these are three different eras of radiation therapy, and we're looking at the outcomes not just in terms of local control, which is improving, but in toxicity to the patient. The top is conformal radiation therapy. The bottom is traditional radiation therapy. More importantly, group 2, which is conformal radiation therapy, is looking at grade 4 complications. Now let me just highlight ocular, this one right here. Grade 4 ocular complication is blindness. Blindness. Do you think avoiding blindness to 0% provides value? Do you think that that's something in the value equation where cost is an issue? Why is it important to measure? Because you want to identify and address gaps in care. So sticking with the same disease, we did not used to electively treat the neck and sinus cancers. We didn't think it was important because we didn't think it was a problem. Only to find out that if you measure, you will find that it is a problem in some patients. And who are these patients? And it would be important to identify them. So we change our practice. This is the nodal control with elective neck treatment. That's the new policy. This is the old policy. Without measuring, we would not have done any of that. And then we also, it's important to know how we compare to others. The yellow bars here is MD Anderson. Now, US News and World Report says we're #1, but that's about the only thing that says we're #1. Are we really the best? I'm sure Jatin Shah and Ashok Shah says, no, you're not. New York is better. And I'm sure Hopkins would say, no, we're better. And I'm sure Mayo would say, we're #1. And then Cleveland would say, we are. And then, of course, everybody knows Pittsburgh is #1. Do we really know? Do we really know anything? Of course not. Because now we're not measuring anything. We're not measuring the same thing. So it's 12 o'clock, and I still got a lot more to go through here, but I'm going to wrap it up. So can you advance to the last 3 slides? Oh, I could have done that. Okay, now go back. So to wrap it up and stay on time, there are some other concepts obviously I couldn't cover, but it was a lot more important for me to honor the people that I honor than cover this material, because I know that I am preaching to the choir, and you already had an amazing talk by Michael Porter yesterday. I just wanted to bring it home to the society. And more importantly, I want to take the next couple of minutes to set the agenda for moving forward. How do we deal with this competition, which was the initial question of the lecture? And I think there's only one answer. If you have been through the merger of the societies, if you have been part of the turf battle about head and neck cancer, you learn very quickly that fighting is not the way. Shouting is not the way. Posturing is not the way. Leading is the way. So how do we lead? This is your charge, AHNS. We need to build a platform for systematic outcome measurement in all 6 sections, because these outcomes are very disease specific. Mucosal, endocrine, cutaneous, skull base, salivary, and reconstruction. The chiefs of those sections are in the audience. This is your charge. I am committed, now that I am going down to the basement, to be of any help if you need it, or not if you don't. Only then will we have a meaningful dialogue about where does a patient with a T3 cancer of the floor of the mouth invading the mandible should go. Who should be treating this patient? What is an advanced medullary thyroid cancer with tracheal invasion? Who's the right provider for that? What kind of training, what kind of certification, what kind of qualifications are needed to address the value proposition for this particular patient? Charge number 2, we need to continue to strengthen our training programs. The reason the American Head and Neck Society is dominant in all these 6 sections is that we have been relentless in providing outstanding quality, training our young residents and fellows. And today, we have standardized the curriculum. Our fellowships are so diverse, as you know. Some are highly reconstructive, some are highly endocrine, some are very much weighted to skull base, and they are very different in their emphasis, and that's good. There is no reason to say, let's make them all the same. I think it provides a rich environment for our trainees to pick and choose what they want to do best. But we need an assessment of competency that we can provide in this competitive environment to say, this is what it means to be an American Head and Neck Society fellow graduate. Then we need to look at certification and a strategy of accreditation. And I know that this year, one of the many accomplishments that you saw of this new structure was exactly that, where we finally have a recommendation of how to move forward with giving this issue a framework within the next couple of years to finalize a certification and an accreditation strategy. That's our platform for how to deal with the competition, and we need to keep the patient at the center of this. This is one of my patients, and he came here with a tattoo of our emblem. And I said, what are you doing? And he said, what you guys have done for me has changed my life so radically. I had to put your logo on my heart. I'm handing this charge to the very able hands of Dr. Sherry Ann Nathan, who is now officially the president of the American Head and Neck Society 2019-2020. Thank you very much.